Hello and good morning, everyone. I just got a brand new piece of research here that I thought was super important that I wanted to share with you. It's research having to do with the efficacy of chiropractic care versus other options that are out there, such as medications, spinal injections, and/or surgery. Now, a top journal in the medical space, especially in the world of orthopedics, is one called the Spine Journal. And there's another one called the Journal of Manipulative Physical Therapy, JMPT. And they just published an article that was absolutely incredible. I'm just gonna read it actually right here from you. They stated that maintenance chiropractic visits could detect, evaluate, and treat an emerging problem, which is low back pain. And it can also prevent future episodes of low back pain with ongoing care. Now, why is this so breathtaking, incredible? Why am I making a video of this? A lot of you are probably saying, yeah, duh, I get adjusted every couple of weeks or every month. Doesn't everyone know that? And really the answer is no. Most of people, chiropractors only see right now about 8% of all of the people. So here in Santa Maria, which we are, let's just say it's 100,000 people, that only means that 8,000 people are going to a chiropractor. So really, what are the other 92,000 people doing? This study actually goes on to say that each year over 9 million ineffective and potentially dangerous spinal injections are given to people with sciatica and low back pain. 9 million injections are given. But check this out. But did you know that when research compared injections head to head to chiropractic care, the adjustments provided more relief? And to take it even one step further, JMPT published a paper that showed people who received chiropractic adjustments improved just as much as if they went surgical intervention, but with none of the risks. Now, I know there's so many people that are out there right now saying, hey, if I have back pain, who do I go see? Where do I start? Do I start with my medical doctor? Do I go to a physical therapist? Do I go to a chiropractor? Do I go to an acupuncturist? Where do I start? And what the research is proving right now is that something that, well, at least I believe that I've known for a long time, is that chiropractic works, guys, and it works better than drugs, it works better than injections, and it seems to work even better than surgery. So it's incredible. Research shows that 89% of patients with sciatica respond well to chiropractic care. Heck, I could probably tell you it's higher than that. You know, in practice, I've been here almost 10 years now, which is incredible to me to think. I probably have only seen less than a handful of cases where I've had to have some sort of higher level intervention. And I mean, I've literally treated thousands of patients with sciatica. So I think 89% is even a low number. I think it's even higher than that. Many people are receiving medications and injections with little to no evidence to support their use. So a lot of people are going to their medical doctor and their medical doctor is injecting them and they're saying, well, why am I getting this? Matter of fact, I had a patient come in just last week, and this guy said, hey, I went to my MD and he said that he was gonna inject me. And I asked him where and why, and he just said, well, you probably need an anti-inflammatory. And that's really the only reason that they're trying to do that. Is it's not to fix the problem, it's just to decrease the inflammation. Now, as a chiropractor, my job is to help fix the problem, to get things back into alignment, to get the muscles to also decrease inflammation, but also decrease inflammation for a reason, and that is because the body is properly healing itself, not artificially healing itself. And then last thing here, it says, more patients improved with chiropractic adjustments than those who also received spinal injections and/or surgery. Chiropractors can help evaluate, detect, and treat and prevent future of low back pain. Now here's the one thing that I want to make sure that we really kind of wrap our brains around, is that Spine Journal, They said this is that people that had maintenance chiropractic visits, maintenance, not one time off, maintenance chiropractic visits. So what does that mean and why? The term maintenance is like, it is equivalent to this. It's like maintaining your car, right? You can go out and run your car super, super, super hard, and then as long as you do what? You change the oil, you rotate the tires, you keep the body in alignment, you wash it, you wax it, you feed it good fuel, right? You make sure everything is in proper alignment, then your car can run for a long time. But if you just go out there every day, you put the crappiest fuel in it, you run it hard, you rev it to the red line every single day, we know that it's going to break down. We just know. I mean, this is common sense, right? So what you need to do is maintain your car. Your bodies are exactly the same, except that you only get one spine and you only get one nervous system, guys. So when you start having breakdowns over and over and over and over again, your car becomes really bad, which means your spine becomes really bad, and that can lead to a lot of degenerative and really lasting changes. So just like the Spine Journal says, maintain your car. What else can you do to help maintain your car? Well, we just talked about it a little bit, right? We talked about alignment. So that can also be not just making sure everything's in alignment, make sure our posture's in alignment. It can also be the fuel that we're eating, the nutrition that we're eating. It can also be what we do to breathe, to exercise, to take in oxygen, to help the body, to help the car run better. There's also a lot of studies having to do now with meditation, having to do with helping the body to heal. And then lastly, detoxification, getting rid of all of the crap, the stressors in our lives, the things that, that we need to get rid of, can also help the body heal. Anyway, I just thought this was a really incredible article that came out. I want to give a little shout out. This is actually from my friend, the smart chiropractor, actually, Dr. Jeff Langmaid. He puts these out for us, and I want to just share these with you guys, with my patients, because I really believe this is so incredibly powerful. So hope you guys have a great day, and I will link the article that we wrote that goes with this underneath this so you guys could read more, and I look forward to talking to you. Bye.